leukopenia or neutropenia. So this can be a disorder in itself, or more likely a symptom of something else like cancer, bone marrow suppression from medications, or maybe metastasis to the bone marrow from another type of cancer, causing a decreased production or amount of circulating healthy adult white blood cells, specifically neutrophils. This is going to put patients at risk for infection. So, our main nursing focus is going to be preventing infection, treating infection. And then for this particular disorder, there are treatment options like bone marrow stimulants, like Neupogen can increase the amount of white blood cell production from the bone marrow. Some types of anemia. We're talking about red blood cells now. So particularly the hemoglobin. Hemoglobin normal is above 12, so less than 12. Uh, Once we get around 8 and below, that's kind of severe anemia when we might need to start doing interventions. This basically anemia leads to hypoxia to the tissues, maybe even ischemia if it gets bad enough, decreased oxygen carrying capability. So it can be iron deficiency, vitamin B12, folate. Um, we're going to manage these patients, supportive care, give them oxygen, maybe transfuse them, packed red blood cells. If it's less than 8, it's an emergency. They're symptomatic. And then we can also give them bone marrow stimulants like Epogen, Epoetin alpha, which stimulates the production of bone marrow red blood cells. Different types of anemia. Aplastic anemia means your bone marrow is not producing enough red blood cells. This can be complication of cancer, certain types of cancer, leukemia, or cancer that's metastasized into the bone, affecting the bone marrow, or it can be a complication of chemotherapy, radiation. The treatments can lead to bone marrow suppression, but you're not producing enough red blood cells. Hemolytic anemia, you may have enough production, but for some reason the immune system is targeting these red blood cells and actually lysing them. So they're going to destroy them and have a decreased circulating amount. Iron deficiency, folic acid deficiency, and B12 deficiency anemias. These can be related to poor nutritional intake or poor absorption of these essential vitamins and minerals used in the creation of red blood cells. So those may be treated with, dietary supplements or injections. Sickle cell anemia. This is a chronic genetic inherited anemia that causes a misshapen hemoglobin that has a decreased oxygen carrying capability and an increased risk for like clumping up and occluding smaller blood vessels, arterioles, capillaries. To prevent oxygen delivery to the tissues, it can cause tissue hypoxia, ischemia, even tissue and organ damage or failure if the sickling and the sickle cell crisis is severe enough. So there are certain conditions these patients will have to be educated on so they can avoid these conditions, or triggers might cause a sickle cell crisis or worsening of their disease. So all the things listed on this slide here: hypoxia, dehydration, infection, pregnancy, alcohol, high altitudes, cold environment, sometimes really hot environment, strenuous exercise, stress, nicotine, smoking, anesthesia. Those are just some of the possible triggers. So really important to educate your patient to avoid those triggers, right? So don't go, fly to Mile High City to watch the Denver Broncos play. Don't smoke, don't party, don't drink alcohol, maybe avoid pregnancy. And then we can also teach them to stay hydrated. So making sure they're drinking 2 or 3 liters a day, if that's appropriate, will help kind of prevent this clumping up or coagulation of sickle cells in the smaller blood vessels. And then they may need intervention. They may need to be hospitalized. So we'll put them on high flow oxygen, obviously, to hyperoxygenate them so we can deliver more oxygen to the tissues. Pain management is going to be huge. These patients will be on like PCA pumps. They're going to be getting strong opioid analgesics like morphine and Dilaudid around the clock. PRN administration sometimes isn't even enough. So we'll just be giving them on a schedule, or like I said, on a PCA pump. We really, really, really want to avoid pain. Pain is going to make this condition worse. It's going to cause the crisis to be worse. So managing their pain, admitting them to the hospital, IV pain medications for typically like 48 hours before they'll be titrated down to some, PO, pain medications. They may even need a blood transfusion if they're anemic enough to where the amount of healthy, normal functioning hemoglobin is so low, like under 8, they may get a blood transfusion, packed red blood cells, and then supportive care, so just caring for whatever needs they may have. Thrombocytopenia is a decrease in platelet count. Normal platelet count is above 150. So the lower we get, obviously, the more concerned we're going to be. The patient's going to be at risk for uncontrolled bleeding. About 50,000, when the platelet count gets down to about 50,000, they're at severe risk for prolonged bleeding from basically any type of injury. Once we get down to 20,000, they're at risk for spontaneous bleeding. So they can just start bleeding into their gut, into their brain, externally from their body, basically for no reason at all. It might even be something simple like they sneeze or they cough and then they start hemorrhaging in their brain. So as a nurse, our focus is going to be on preventing injury and controlling bleeding, right? So they might be admitted to the hospital, activity restricted, or they might be at home and we're educating them on, injury prevention. And let's say they're in the hospital and they get like their blood drawn, you might need to hold pressure for a very long time. So educating staff, like a phlebotomist, you might have to hold pressure for 10 minutes or longer. Avoiding invasive procedures or taking unnecessary blood pressures, things like that can cause like bruising, bleeding, complications. Interventions, they might need some vitamin K. If they're on heparin, so there's a thing called heparin-induced thrombocytopenia, we might be giving them the heparin antidote, protamine sulfate, right? But some vitamins and dietary supplements like vitamin K. And then they may also need a platelet transfusion if it's severe or if they're bleeding. We can give them a platelet transfusion. And then there are also thrombopoietic agents like the Neupogen and Epogen. We can also give a thrombopoietic agent to stimulate the production of thrombocytes in the bone marrow. They may also get cryoprecipitate, which is like a bunch of clotting factors. It's a blood transfusion that's typically given like in emergency situations to control bleeding. So somebody who has severe thrombocytopenia and bleeding, or maybe even like a hemophilia patient, or somebody like complications from thrombolytics. Like sometimes we're given thrombolytics for a stroke or a heart attack and they'll start bleeding. We can give cryoprecipitate is a good drug.